Thank you, Darra. I really appreciate it. And hopefully I'll be able to cover some of what Darra had mentioned was the difference between personal care services, home health, palliative care, and hospice payers, and who is involved in each care team for each business line or service line that you may be encountering. Go ahead, next slide. Okay, so what is home care? Home care, also called personal care services or caregiving services, that is a service where we are providing assistance with activities of daily living. So the best way that I can describe that is what we are blessed enough to help ourselves with every day: brushing our teeth, using the restroom, showering, brushing our hair, going to the grocery store, managing our medications. In terms of medication reminders or picking them up from the pharmacy, those are all things that caregivers can help with. And the goal is to help that participant or client live as independently as possible in their home for as long as they can. Home care or personal care services can be paid for privately, or they can be paid for through Medicaid. Unfortunately, something that we are seeing a lot of is participants or clients believe that Medicare covers personal care services or caregiving services. And so that is a misunderstanding that a lot of clients have. And right now, Medicare is not covering the activities of daily living or those caregiver type of services. The VA will also cover some of those services. They assist with things like respite for a family caregiver, and they assist with bathing help and homemaker. And then also some long-term care insurances will cover personal care or home care services. One of the biggest points to mention is most long-term care insurances will require that the agency has a registered nurse on staff. And that nurse usually needs to develop the plan of care for the long-term care insurance to cover that. And many times, clients don't know that, family caregivers don't know that. They'll pick an agency, they will start to develop a relationship with a caregiver, and then they'll quickly realize that the long-term care insurance will not reimburse because they've required a nurse. So that is something that it is important to note when you're working with a care agency, that they have contacted the long-term care insurance company and that they are aware of when they can be reimbursed for service. Moving on into home health. Home health is also called skilled nursing and therapy, or more of the medical side of care. And that is where you're seeing your skilled clinicians. So your occupational therapist, your physical therapist, home health bath aides, and your skilled nurse. They typically are looking at things such as wounds. So they're going to help work on wounds and get them cleared up. But basically the main goal for home health is to see progressive improvement over time. And if they don't see that progressive improvement, then typically they do end services. So home health is an intermittent type of service. It's not intended to be long-term. Caregiving services can be as long-term as is needed. Again, if it's paid privately, as long as it can be financially sustainable, or if it's paid through Medicaid or other long-term care insurances, as long as they were authorized the service. Home health is intended to be short-term. Most often it's 60 days. Sometimes it can be longer if the patient does need maintenance. But again, that is insurance driven, and that's going to be paid for by Medicare or other Medicare covered insurances such as Aetna, UHC, Humana, Blue Cross, Molina Healthcare, and those type of payers. It can also be paid for privately, shall the client want to do that. Kim, would you like to take over for the palliative and hospice?
Sure. So the palliative and hospice are often a little mixed up, and palliative as defined is sometimes in a gray area, and it's in a circle kind of all by itself, but it's really a care management team where you have a medical doctor who's kind of overseeing all of the care, and you may have a social worker that's also working with the patient. It's very patient-centered, and they're looking at mostly about managing. They're managing life-altering diseases. When you're on palliative care, you can also have home health involved, home care involved. You can also have, you can be going through treatments at the same time. It's palliative, the palliative term by definition by Medicare is it's really just the medical team working together. So they're actually billed separately. Like the doctor's visit would be billed separately. The social work might be billed separately. Your specialist would be billed separately. And most of the time you go to them, they don't actually come to you. Whereas hospice is it's like, well, and I'm very passionate about hospice because that's my background, but is more like I would call it an egg, and it just comes with everything and it wraps around the person. And so they come to you wherever home is. And you have a medical doctor who oversees kind of the care plan, but it's usually a nurse that is in charge of your care plan. And they really focus on the goal of what the patient wants. And it's managing symptoms of a disease process. It does have to be life limiting. It doesn't mean you have to die within a certain amount of time. Typically, especially in Idaho, they have hospice start way later than they could. They could qualify much earlier. But a lot of people are afraid of the word hospice. They think, oh, if I'm on hospice, I have to be in bed, I have to be homebound, and that's not the case at all. And then payment is, 100% of it is by Medicare. And it also, if you're young and you're not on Medicare yet, it is covered by most of it's covered by insurance, private insurances. When you look at all four of these entities, the only thing that really can't commingle would be the home health and the hospice. And if you look at it, home health is really about getting that person better, and hospice is about maintaining or helping that person as they decline. And so there's two separate goals. And so you can't really be on hospice and at home health at the same time. But I like to think of home care when you have caregivers. And Nichole, I'm excited for you to talk a little bit about how we can be advocates for it. But home care is like, well, it's like the frosting in my cake, because it covers all the cracks. When your cake has all these pieces, it kind of fills those pieces up and makes it into this, complete care plan for you. I think the hardest part, Darra, you mentioned this earlier, is just managing all of that. Like, you have different people coming in at different times, and you lose track. Sometimes you'll have two different home care agencies coming in to fill in the gaps. And then you'll have maybe a nurse come in, and then you might have a social worker come in, or a chaplain come in, especially in your case with hospice. So it is really confusing, and it is really hard to keep track of. And it's hard also, I feel, sometimes you lose track of what is really important to that person.
I think I'll just say one other thing before I hand it back to Nichole. I think that the reality is trying to figure out how to find those resources, knowing that, hospice in our case, because geographically where we were was different from home care. There wasn't an entity that did both. And that's very often the case. Like you said, coordinating all of those activities, finding the home care coverage, trying to find it through resources, when would he be eligible for Medicaid? And okay, then he would be eligible, but there's no caregivers there. So back to that home care, multiple agencies. It's very tempting and easy to get lost in the busyness of that. And we need to help those families and those family caregivers so they can do what we worked really hard to do, which was spend the time and be with the loved one, which, as Marnie highlighted, is really an important part of that process. You need to honor yourself, honor them, and it's very easy to get wrapped up in the process.
Very well said.
Yeah, and a few things I want to note. So going back to home health, it is also covered by Medicaid. So I forgot to mention that. I want to make sure that that's mentioned as well. And another very confusing thing with home health is a lot of clients will think when they get on home health, they get 3 bath aid visits a week, 3 physical therapist visits a week, 3 visits from a PT a week. And that's not the reality of how it works. So unfortunately, with insurance and home health specifically, those agencies are very limited to how many resources they use at a time. So you may get physical therapy 2 times a week and a skilled nursing visit 2 times a week. But having all disciplines, a bath aid, social worker, physical therapist, occupational therapist, and a skilled nurse in the home all at the same time is very, very, very rare. Usually if that amount of care is needed, then it's when we're looking at, is this person going to be able to progress and get better, or do we need to talk about alternatives? And Darra, you bring up a great point. I think agencies also forget, we'll get into, and if we could go to the next slide, but knowing who is a part of the care team and who to call on for resources is also important. So with home care, there's a care coordinator who truly is there to help manage the care of the client and their family, and to make sure that they know the resources that are available to them. They should be looking and identifying for those types of things if hospice is going to be appropriate, if the client needs home health services. They should be coordinating directly with the home health agency or the hospice agency and helping the family navigate some of those issues. Also with home care, Molina and Blue Cross specifically, they have care managers, a part of their teams that are available. And I think clients sometimes are not aware, or the families especially are not aware, that that benefit's available to them. So if they are getting home care services paid for through Molina Healthcare or Blue Cross, you have those care coordinators that can help you navigate those service lines and help answer those questions. And a lot of times that's not something everyone really knows. We kind of in extra services, we did discuss a little bit about that. Caregiver, family support, the home care team should be there and is there to help provide that information and offer that support to the family, and make sure that they are focusing on what the patient and the family needs in terms of care, schedule the appropriate caregiver, who's the best fit. That care coordinator and the home care team should be looking at that. Some additional services is they can assist with transportation. Most agencies can, not all do, but they can assist with transportation to a doctor's appointment. They can also assist with that respite care and companionship if needed. So next slide. And we'll go to the next one. So this will go over the home health team. Your medical doctor is really involved in home health. So for home health to be ordered, that order has to come from a physician. It's not like home care or personal care services where you can call and say, I'd like a caregiver. If you want home health, that coordination has to go through the doctor, the family doctor, whether that's your PCP, an orthopedic doctor. Your doctor needs to write an order for home health. That team at the home health agency is going to be case manager, but it's really the clinical director over the office who manages all of those clinical services. That is the person who's looking at the disciplines, whether that's PT, OT, and then the frequency, how often they're coming out. That clinical director is really responsible for keeping an eye on that and making sure that those patients' needs are met. And then again, as we mentioned, occupational therapy, physical therapy, skilled nursing. Additional supports of home health is the social worker, and then also a CNA. For Medicaid, home health will not cover or pay for social work services. Some home health agencies will cover that as a benefit to the patient at no cost, but to keep note, Medicaid does not reimburse for social work services. So not all agencies will provide that. Next slide. And we'll keep going. Kim, do you want to go over the team for palliative and hospice?
I mean, yeah, we can. We kind of went over it already, but it really is. There's usually your lead doctor, your primary care doctor, or the lead specialist doctor. If you have a chronic disease that's progressing, and then they coordinate with the medical team, and the treatment schedules and the medicine management and all of that is really just this team. But it does fall a lot on the patient and their caregivers, again, to make sure you go to the appointments, make sure that you're taking the medications. Like there's a lot of due diligence that comes back on the caregiver for that. And then they do have a social worker. They should have a social worker, and even behavioral health is now becoming part of it. I think as insurances and as healthcare in America, we're going to more of a managed care model, which is like a team that oversees everything. So you should have those types of resources that are included in with your insurance coverage, basically. You can change the slide. And then the hospice team we talked about too. The thing about hospice is it's an a la carte kind of deal. The only thing you have to have is a nurse to come and visit you. I believe it's been a while since I've done it, but I think it's every 2 weeks, has to come in and do a face-to-face. And then there needs to be a face-to-face in the initial start of care. And there is a social worker that you can request to help you kind of with maybe funeral planning, or if you have any type of questions that you need help with. They actually should be helping you with some of the personal care services and caregivers, and helping you find resources to fill some of those gaps. So those social workers you can use as needed. And then you have your medical team and your CNAs, which can help with bathing and personal cares, and your nurse that you can call whenever you're scared and things aren't going the right way and you're not sure what's happening. It's always nice to know that you have that team right behind you that can kind of help you navigate through some of those unknowns.
I know we're running short on time, but I do want to bring up, again, as Darra had mentioned, there is a huge caregiver crisis and shortage for Medicaid, for all caregivers, but predominantly for Medicaid reimbursed services. And so for those of you who are not aware, please educate yourself on that shortage. Don't wait until you yourself are experiencing it to become involved. Contact your state legislators. We need to provide education to them right now. We've had a lot change out in this past year, and we're starting over in terms of education. For personal care services specifically, they declined increasing our rates. Right now, the reimbursement for Medicaid for caregiving services is about $21 an hour. And I know you all drive around and you see what people pay, and agencies right now cannot keep up with that. And so it's really important that we provide that education. Contact your legislators, call them, email them, contact personal care agencies, let them know how you can get involved. There's websites that are easy. I can put one in the chat if I can find it quickly. You can log in there, get access, put your name in, and it'll automatically send it to the list of legislators, and you can personalize that as well.
I'd like to jump in and just say one thing really quickly too about personal care services, that even though they may reimburse at 21, we have the overhead of the care coordinator, and then if you are supplying health benefits and supports for the caregivers, that takes out of that $21. And so sometimes we forget how expensive it is to actually run the business. And so I just wanted to add that on top of,
the caregivers are not being paid $21.
They're not getting
That's
paid
what the
$21.
agency is getting.
Right.
And so the
to
caregivers
cover the cost, right?
The caregivers are making much less than someone who can get a job at Walmart or McDonald's.
Darra, Nichole, Kim, thank you so much.